hospital at the first place. But me call hospital, nothing's normal request to one. It was too much. Na skekita me nyinga den. Asa. The first time I'm going, I make almost 70 Ghana. No, me see me go just scan. Me go just scan no we, no me see me go a book. Midwife, na midwife no. Let's say omo be checking urine na. Nti na fi dem me see kan nyinga den. Asa. Nti me catch and turn do onyama me the scanner can be den. E be so ama no. It was one and PA, not like I wasn't say me mo be am ko this scan one hono. Nti na me feel like me guy na me no one na na me say nkan no. I'm cutting out on it. Now, it's not like me pay means away. I meet ya. Nurse Nini can answer my coffee. To meet anyone I'm committee. Ema. Now, me name no baby. Oh, baby, say me change.
Okay.
I'm going to say me need change in a bit. No, so, oh, na compensate society. I'm movie. I'm so me need change. One or so, okay, what's it? Now, I'm starting to say me nini heading. I can't say me explain things. Actually, not ordinary. I'm the good to you. I am getting me a lab, but because of this can end so. It's mommy jay lab on here. I'm going to me a lab later.
Some women have experienced the pain of losing a baby through miscarriage just when they were getting used to the idea of becoming mothers. Some have also gone through the entire 9 months, been to the hospital to be delivered of a baby, but returned home empty-handed due to stillbirth. Husbands have taken their wives to the theaters to be delivered of babies, but returned home with neither their wives nor babies. For these reasons, women are continuously advised to report for antenatal in the first trimester, which is the first 3 months of pregnancy, to get guidance to live healthy in the 9 months journey to reduce the rate of miscarriages, stillbirth, and maternal mortality. Mrs. Eunice J, a mother of 1, went through the ordeal of losing her pregnancy at almost 7 months.
When we went to the scan room, and they turned the machine on to search for the baby, they couldn't find it, nor the heartbeat of the baby. I was just at the point of death because I had lost so much blood and I was very weak. I kept praying on our way. When we arrived at the hospital and they were putting me on a stretcher, I realized that I was dilating, as at that time my baby was already dead. God being so good, the moment I was put on a stretcher to go into the theater to bring out my dead baby, I just realized I was dilating and it came so fast. So as they were taking me off the stretcher, my baby's head came out. My baby was already dead.
Although my child was 6 months, 3 weeks, he was fully matured. Such a nice boy, was fully matured. I kept crying over my lost child, and I was so enthused about the pregnant, losing my child, my son. That whole 3 weeks was like a funeral time for me. I am always wailing and crying. I'm always very down. I barely eat. I was so disturbed. But after the 2-3 weeks, my husband was the one encouraging me, kept telling me that God gave us and God will show.
From the above account, losing a baby is indeed no joke. One therefore wonders why, after all such sad stories and vigorous campaigns by the Ghana Health Service to convince pregnant women to seek prompt maternal health care, many women, especially the poor, fail to report early for health care. My name is Francisca, Emefa Enchill. I set out to investigate and find some answers. The result was that there were warts in some health institutions that put impediment in the way of the poor pregnant women who seek health care. Public health centers, which are patronized by majority of pregnant women in Ghana, were put on the spotlight. They were the Kanishi Polyclinic, La General Hospital, formerly La Polyclinic, and English Amman from Health Center. These facilities are patronized by mainly poor women. To be able to gather solid evidence, I had to go through the antenatal process. So the services of 2 pregnant women were hired. One of the pregnant women had been in the house for 5 months without attending antenatal. Her reasons: she did not have money to pay for the many bills charged by health facilities. But according to Ghana Health Service, antenatal services are free. So why the bills?
Ghana, no. Anyone, my catching some by it was like Uniska, mention, then the Romiska, Ako Hospital about 1 month. It was 5 months. Na me who say no, say my uncle hospital and the guy we here. Emergency. It's me and the sick hospital at the first place. But my hospital, nothing's normal request to one. It was too much. Na skekita meaning I asa. The first time I'm going to make almost 70 Ghana.
During this investigation, it came out that all the 3 health centers focused on were guilty of illegal practices that make accessing healthcare in pregnancy a difficult task for the less privileged. The health centers were engaged in extortion and charging of illegal bills without issuing receipts. I was at the Amam Health Center, and extortion of money from pregnant women was at its best. On the first visit to the antenatal unit of this health center, what one sees is shocking. Unlike all other health centers, this health center issues a 9-page photocopy of the original red maternal health record book, popularly known as folder, but referred to as card by health workers. Just a handful of patients in this health center are given the original books, while majority of pregnant patients are given the photocopies for 5 Ghana cedis, with the excuse that the center has run out of original books. After paying for the folder, pregnant women go to a health worker who sits at a table to check vitals, which are temperature, height, weight, and blood pressure. The pregnant women are asked to drop 1 cedi into a carton placed on the table without any reason given. Put 1 cedi in the box is all they say to the patients. They are then asked to buy plastic containers to get urine samples at the cost of 1 cedi. The patients then go to the consultation room where they pay another 1 cedi for a test kit to be used to run a test on their urine samples. A blood test on hemoglobin and HIV/AIDS is run on each patient using test kits, and then they are asked to pay 10 cedis for those tests. So the patient ends up paying 11 cedis in the consultation room. This is what a nurse at Amanfom told Kasapa FM's investigator when she visited the facility with a pregnant lady to start antenatal.
And then
Card numbers.
5 or 6. I believe card plan by readiness.
What health insurance?
And card.
Health insurance in Ghana folder.
White one, I wait and time back. It's about the photocopy number. Tell me if I see this. I think someone the mobile net, the one tell me if I see. Register like a shorty.
While sitting at the antenatal center, the only thing you keep hearing are these sounds from health workers.
5 cedis. 5 cedis.
The next visit was to the antenatal unit of the Kaneshi Polyclinic. The first instruction from health workers at this facility is to acquire a folder. The folder is supposed to be given to pregnant women for free, but at the Kaneshi Polyclinic, the folder is sold at 5 Ghana cedis.
5 cedis. On the card.
Hey, a young soul. Jenny, I'm going to mention sorry, why?
The next stage is to pay 50 pesos for a plastic container to get urine sample to the consultation room. To visit the washroom of the clinic to even get the sample, the pregnant woman must dole out another 50 pesos. Vitals are checked before seeing a midwife. In there, the urine sample is tested with a test kit. After the test, the pregnant patient is asked to dish out money again for the test run, and this costs 5 Ghana cedis.
5 cedis, right? Just when I tested. If Mama laugh, would the insurance?
We end this journey at the La General Hospital, popularly known as La Polyclinic. There were also instances of extortion in this facility. Patients are made to pay for folders at a cost of 5 Ghana cedis and buy 4 different plastic containers for collecting urine samples at a cost of 2 Ghana cedis.
5 cedis. I didn't see you here before. 5 cedis. 5 cedis. Don't be nice.
Let's talk for card money.
Card me 5 cedis. I'm coming
To visit the washroom to collect the urine sample, the pregnant woman is charged 30 pesos without tissue paper and 50 pesos with tissue paper to enter the place. Aside the above listed bills, all other services were, however, free as it was supposed to be. The services included checking of vitals, urine tests, HIV tests, and consultation. This investigation also discovers the fact that pregnant women are not given receipts for the various bills they pay at the antenatal unit of these health facilities. This brings to fore how monies are accounted for, where they end up, and if the facilities are making revenue internally. At the maternal health unit of Kaneshie Polyclinic, receipts were not given for all the monies paid at the various sections visited. When a midwife fondly called Auntie Sewa by her colleagues was asked for receipt for monies paid, she blatantly responded that they don't give receipts there.
Ma'am, but your book new when you receipt, yeah, man, receipt.
Urine testing.
Okay.
At the laboratory of Kaneshie Polyclinic, the scene is friendly. Transactions go on, but receipts are not issued. Kasapa FM's investigator pays 50 Ghana cedis directly to a lab technician who had a small carton on his desk, where he dropped the money and gave a 20 Ghana cedis change without issuing receipts. At the Amanfom Health Center, no receipt was issued for all the payments made. They included payment for folders, vitals, urine test, container, and hemoglobin test. Although the La General Hospital was also charging fees they were not supposed to, the health workers issued receipts for the 5 Ghana cedis charged for the folder, but gave no composite nor separate receipt for the other services. After gathering enough evidence, it was time to meet the heads of these facilities to find out why these activities were ongoing in their facilities, and if they were not aware, to know why they were not in touch with the practices in their hospital when they were open facts. In an interaction with Dr. Patrick Amomensa, the medical director at the Kaneshie Polyclinic, he said he was not aware of the bad practices, but was interested in investigating internally. He said he will apply appropriate sanctions when necessary to individuals found guilty.
Lab, no call lab there, or say your mouth receipts when you go to the lab. Because some of these things, without your helping us to also know, a lot of people also deny.
Yeah.
Lab, it's a lab for the day. Recently, lab by incorporate from the lab because of some sad yesterday. Because all those people are shown, I was here punishment.
Okay.
No call lab, and I just scanning your mouth receipt. Oh, so some of these things you are it's difficult. Me now be to say what and can't say it's difficult. So that yes.
Yeah.
Who beside the Bakon is here, they will deny. The Bakon call lab, and I in the car. So it's like okra or boy because it means that we are also losing revenue. And this case I want is about the pregnant woman who went to the lab. Yeah, getting this guy man receipt me boy. Okay. And also
for the
data card was also sold to her.
5 cedis.
And urine test is almost with them.
And also 5 cedis.
Okay.
Ghana Health Service provide him with containers for collecting of samples, and I say the hospital is supposed to get it and sell to patients.
No, the truth of the matter is this particular issues, one will say, well, we have tried as much as possible to try to eliminate that nyama way, okay, by letting them go to the laboratory to do all that, okay. na minim the OJ 5 cedis, you know, and I minim the OJ Sikano for, you know. And the best I'll do for you is let me get to the bottom of this.
Dr. Akos AEC, the medical director of Amanfom Health Center, however, insisted that her facility was not practicing any of the things that Kasapa FM gathered. She said if those practices were indeed happening, then it was being done by individuals and not a norm by the health center.
But with us, antenatal care is provided, covered by NHIS and cash and carry. And then over the counter if you don't have NHIS. So, and all things that you do are supposed to. We don't check BP, we don't check weight and take money for it. We don't check whatever. All the other things, it's not part of us. It's not something that we do. We get complaints all the time. We investigate. The ones that we have to do, the people are queried. They follow the due disciplinary process for it. You understand? Okay. So if it's someone that is doing it, this is not a standard practice with us. It's not a standard practice. That's why it's here. So it's not standard practice. For us, we take NHIS and then we pay over the counter if you want to pay for it. That is if you do not have insurance. But if you have insurance, you are covered by insurance. So what insurance pays for, we let you do it. If you have to pay something else that's not covered by insurance, then you pay. But this is not standard practice because you are supposed to have fees for everything that you do. And
so
everywhere.
Your place, does insurance cover folders?
Insurance covers folders. Insurance covers folders.
I really have them by readiness.
What health insurance?
And cover.
Health insurance in cover folder.
Speaking in an interview with Atindana Nsombila, the administrator of La General Hospital, he admitted that the facility was selling folders and other basic items of antenatal and confirmed that those items were not supposed to be sold.
What I can tell you is that sometime last year, the region ran out of the ANC, particularly this hospital. So we tried to find a way of getting some. So eventually the region decided to get some.
The regional
health directorate, okay. Our regional office, they managed to procure some. And it was given to facilities at a cost. And how much we were supposed to give it to?
At what cost were you given? And at what cost were you supposed to sell it?
It was less. We were supposed to give it to the end user at a cost not more than 500. Which means that we got it from them less than that. Okay. Yes, I can't. The exact figure, I can't remember the exact figure, but it ranges between 3 to 5. Yes, so we are supposed to give it to the end user at a cost not more than 500. Yes, and that was when the region decided to procure it or to print it for the facilities. Apart from that, nothing is paid for. So before we ran out of it, that is what we had before the shortage. It was given to them so long as they are registered under the National Health Insurance Scheme. And as we speak, that is the practice. So we've just gone for some. And so long as you are a pregnant woman and you are registered, it's given to you at no cost. So the cost is transferred to the health insurance scheme. So the person accessing the service, that is a pregnant woman, does not pay. Unfortunately for us, the basic ANC services that we provide are covered under National Health Insurance Scheme.
After drawing the curtains on the health centers, it was now time to speak with the Ghana Health Service, the institution in charge of healthcare provision in Ghana, to find out the policy guidelines for antenatal services in this country. I spoke to Mr. Kwabena Edweje, head of procurement at the Ghana Health Service. He disclosed that the Ghana Health Service had support from the United Kingdom's Department for International Development, DFID, to print and distribute over 300,000 copies of the folders. Hence, the Ghana Health Service currently has the folders in abundance. He added that the folders and other items that go with antenatal healthcare provisions are supposed to be given out to pregnant women for free.
In terms of the maternal health record book, we have enough in the system. With the support from DFID, we've been able to print about 300,000 copies, which has been distributed to the various regions in the various facilities. So in that regard, for recording of maternal and child health record, we have enough maternal and child health record in the system.
Have you received reports from any hospital that there is shortage of folders?
Before the month of July, we were having shortages. But with this support, we're able to print enough which will cover the country, hopefully up to the next year, hopefully up to the end of the year. We are hoping to start another one.
So as in this October, you've not heard any?
There's no records to show that there's a shortage in the system. We've distributed to all the facilities in the country.
There's a health center which is giving photocopies of the Red Book to patients.
As of today. Then
actually in the hospital yesterday. So they are not supposed to use the photocopy.
They are not supposed to use it. There's enough in the system now. So anybody who is using photocopy, if you know any of them, you should contact the original health directorate.
How much is the folder supposed to be sold?
They are supposed to be free. They are not to be sold.
The red folders?
Yes, it's supposed to be given to the pregnant woman free of charge. They are not to be sold. So anywhere you find people selling them, let us know. They are not to be sold.
So when you get to know that they are being sold somewhere, what happens?
Okay, you refer to the immediate authority is the district health directorate. Okay. Report to the district director of health directorate, and then they will take action. You can also refer to the regional health directorate of that particular region, and they will take action. They are not to be sold. It's a free maternal child health record. As I said, we had a support from DFID to print those books for free, so they are not to be sold.
That aside the folders, what other items are you providing for the health center so that they don't charge patients?
Most of the maternal and child health record formalities are given to the pregnant women for free.
You provide those test kits for them?
For most of the tests, even malaria test kit, HIV test kit, they are all supposed to be free. Oh yes, the services we charge and the things we sell, they're supposed to have a receipt books for them. And even the ones that we give for free, they have to record them, because you have to account for it. Even if it's free, you have to account for it. How many of them did you give out for free? So those we pay, there is a receipt. Those they give for free, you have to record in your store ledgers. They have to account for each of item that goes out, whether it's for free or they pay for it.
But they can buy any other thing except the folders. The folders are not on the market to buy.
Yeah, for the folders, you can print or duplicate them. We have to provide you. So that's why when there's a shortage, we find all other means to get money to print more into the system. They are not supposed to be sold. It's supposed to be given to the pregnant women for free.
I further spoke with Mrs. Gladys Brew, the head of family health at the Ghana Health Service, and she emphasized that antenatal services and everything that goes with it is supposed to be free.
All I can say is that antenatal services and everything that goes with it is supposed to be for free. Okay. So if you are saying that they are paying for those things, you have to ask the managers of those specific facilities why it is so. So for me, I can only tell you the policy that antenatal services are supposed to be free. So antenatal services and everything that goes with it is supposed to be free. But if they say they don't know about it, then bring it out to the fore.
Okay, I will.
Because it is what they have said. They said they don't know that this is happening. It means that they also know that the things are supposed to be free. Sitting at national level, I know that antenatal services are supposed to be free. I'm not providing direct service. Okay. Mine is because I'm not in the facility. Okay. So when you see something wrong with the facility, then you go to facility management, and they have told you that they are not aware. So now let them know that they should be aware. You should be aware that something like this is happening. Do you understand me?
Yes, I do.
What you are doing is good. You are acting as a watchdog. Antenatal services are free, just like is stated in the policy.
Other observations that came out during this investigation were, despite having banks in these health facilities, all these bills paid by pregnant women were paid on tabletop to health workers like a marketplace, except scan that is paid at the bank. Another observation was that La General Hospital was the only facility that was giving treated mosquito nets to pregnant women on their first visit. My name is Francisca Emefa Enchill. This investigation was sponsored by UNDP and Media Foundation for West Africa.